Today's episode, I will be discussing about the COVID-19 cytokine storm. But before that, if you are new in my channel, please don't forget to subscribe, tap the notification bell so that you will be notified in my next video. Before discussing about the COVID-19 cytokine storm, let's have a short background of our immune system. Our immune system protects our body from outside invaders such as bacteria, viruses, fungi, and toxins. There are two types of our immune system. We have the innate immune system, in which we are born with, and the adaptive or acquired immune system, in which we develop when our body is exposed to such pathogens. Our immune system has an exquisite mechanism capable of responding to various pathogens. Now let's talk about the normal antiviral response of the immune system. When the virus enters the human body, there is a rapid and well-coordinated response of the innate immune system and activation of inflammatory pathways. However, if there are exaggerated and dysregulated or uncontrolled response of the immune system, it causes a severe disease or it damages the human body, and it is called the cytokine storm. So what is cytokines? Cytokines came from the Greek word cyto means cell and kinos means movement. Cytokines are cell signaling molecules that aid the cell-to-cell communication in the immune response, and it is also stimulate the cell movement towards the inflammation, infection, and trauma. The cytokines are essential part of the inflammatory process in the body. Due to the influx of various immune cells or pro-inflammatory cytokines from the circulation to the site of infection, this causes a destruction of the human tissue, which will result also to damage of the vascular barriers, capillary damage, diffuse alveolar damage, multi-organ failure, and even death. Lung injury is one of the consequences of the cytokine storm that can progress to acute lung injury to more severe acute respiratory disease. Cytokine storms ultimately causes high fever, excessive leakage of blood vessels, extremely low blood pressure, low oxygen level, pleural effusion, excess acidity of the blood, and even blood clotting. Some individuals infected with severe COVID-19 develop an abnormal blood clotting. The massive inflammatory response, which is the cytokine storm, raises the clotting factors in the blood. That is why if the clots will lodge in the lungs, it will cause pulmonary embolism. If it's in the legs, it will cause DVT or deep vein thrombosis. And if the blood clots will lodge in the arteries going to the brain, it will cause stroke. Or even the arteries going to the kidney, it will cause kidney failure. Some patients in ICU are being observed to have this reddish or purple colored toes, and they call it the COVID toe. This is due to the small blood clots that lodge in the tiny vessels going to the toe. That is why the doctors prescribe blood thinners to prevent blood clotting. That's all for today. If you like my videos, don't forget to like, share, and subscribe. Tap the notification bell so that you will be notified for my next video.